All right. Hi, everybody, and thank you for joining today's session, which is entitled, How is Mental Health Care Evolving in Virginia? Our presenters today are Martin Mash, who is the Network Program Director for Vocal Virginia, and Dr. Zipporah Levi-Shackleford, aka Dr. Z, who is the founder of Creative Approach Development Center. Before we get started, there are a few housekeeping rules we want to address. Speakers, please remember that we are using live captioning and interpreting services. When you first introduce yourself today, whether it is as a speaker or as a participant later on, so this applies to everybody, please include a physical description of yourself and your preferred pronouns, such as my visual descriptor and pronouns. My name is Virginia Ferris. I'm a senior advocate with dLCV. I am a white woman with blonde hair in a bun and glasses. I am wearing a red t-shirt and have the dLCV Summit blue background. My preferred pronouns are she and her. This will help provide context for attendees who may be blind or vision impaired, and will also help our interpreters and captioners locate who is speaking on screen. Please stay muted at all times unless you are the speaker, and please hold all questions until the end. We do have a chat box that I will be monitoring and popping all of your questions as they come up into my list of questions for the session, so you can put in questions there. At the end of each session, the moderators may select some additional questions from the chat box if I haven't asked them already. If your question is chosen, you may take yourself off of mute and ask your question, or simply type your question in the question box. So with that in mind, Dr. Z and Martin, in that order, would you care to introduce yourself and give your visual descriptor and pronouns?
Sure. Good morning, everyone. I am Dr. Zipporah Levi-Shackleford, known as Dr. Z. I am the founder of Creative Approach Development Center here in Richmond, Virginia, and I am also a behavior and education consultant. I focus on working with those ages 5 and up that are neurodivergent, helping them develop new skills and routines and schedules that bring them closer to independence.
And Martin?
Hello, my name is Martin Mash. I am the Network Program Director for Vocal Virginia, which is a 100% peer-run statewide nonprofit that focuses on mental health advocacy and education. I am a white male with brown hair that's parted to the right. I'm wearing a blue suit with a blue and red tie and a white shirt, and my pronouns are he and him.
I knew I was forgetting something. I forgot my descriptors. So I am a Black female. I'm wearing glasses. I have long curly blonde locks, and I am wearing a yellow shirt. My background is light blue with some framed degrees and pictures, and my pronouns are she, her.
Can we start, you guys tell us a little bit about your background, your history working in the mental health field? Martin, I'll call on you first because you're not muted.
Sure, that's fine. So my background is largely in public policy. I've been with Vocal Virginia for about a year. I am a peer. You know, Vocal Virginia is staffed and governed by individuals with lived experience of mental health concerns. So I fit that description, and I took my experience in public policy and have been applying it to mental health in this capacity. I worked for 5 years for the U.S. Senate, and I worked for about 2 years at the Virginia Department of Elections as a public policy analyst, and have since been applying that to advocating on behalf of Vocal Virginia's members. We have over 2,000 members throughout the state who have experienced mental health challenges, and we take their voices and amplify them before the General Assembly and the state administrative offices.
And my background started when I was about probably about 12. I am the older sibling of a brother who has bipolar disorder, as well as some learning disabilities. And then years later, I became a mom. I actually have 4 children. 3 of my children are on the autism spectrum. My youngest also has a rare form of Down syndrome. And then along with those diagnoses, they have diagnoses of ADHD, anxiety, depression. So became initially involved from personal, experiences and ties as being a sibling and then a parent. And then when I started the company, I focused on working with those that have intellectual developmental disabilities. I am a DD waiver provider. And the more that I started working with these individuals, I started noticing the comorbid diagnoses related to mental health problems and mental illness, which led me to doing more research and learning more about the dual diagnosis of intellectual developmental disabilities and mental illness. And now I focus on advocating for mental health services in the IDD community, because they're often very much separated, and provide lots of training and education to providers and caregivers and community members about how common it is for somebody with an intellectual developmental disability to also have mental health. And then lastly, my involvement, I am the chair for the Disability Law Center of Virginia's PAIMI advisory council, which is an advisory council that provides recommendations to dLCV under their grant that focuses on providing supports for people with mental illness.
So can you tell us, you guys already gave us a really nice primer of the agencies and organizations that you work for, but can you tell us a little bit about what you are currently doing to promote systems change around mental health care in Virginia? What some of the current issues and battles are? Go ahead, Martin.
Okay, thank you. So just a little more about Vocal Virginia. In addition to providing advocacy, we also provide technical assistance to other peer-run organizations on nonprofit issues such as board governance and fundraising. We also provide education. We provide APPR classes, which stands for Action Planning and Prevention for Recovery. We provide classes on working with individuals who are hearing voices, working with individuals who have unusual beliefs. We offer a variety of trainings throughout the year. And also in terms of advocacy, we do an annual advocacy day with NAMI Virginia and Mental Health America Virginia, where we bring our members together for a day at the Capitol to visit with their legislators. We also offer a weekly newsletter that brings people up to speed on issues of national and statewide importance in mental health, as well as trainings that are taking place throughout the state. Some of the issues that we're working on in mental health right now, we're working on barrier crimes. This is in terms of our advocacy agenda. We're looking at barrier crimes, the Medicaid High Needs Supports Benefits, which offers housing and employment supports to people with complex behavioral health concerns. And we are working to, we're working to decriminalize mental health and address the issues surrounding often young Black people and young people of color being treated aggressively at the hands of law enforcement when they're in mental health crisis.
And I definitely have to say, Martin, that I appreciate that and the different areas that you focus on. I focus on those those areas as well. And I think what I try to do again is bring awareness of the IDD population being included, because again, it's often not included in talks about mental health and mental illness. I provide training for mental health therapists and providers to help them understand how to modify their resources and approaches in a way that's appropriate for those with an intellectual developmental disability. Because often the traditional approaches are not as effective. You know, those with intellectual developmental disabilities may need things broken down in a different way. They may need more visual support. So I provide different workshops and training to assist with that. And then also just working with other organizations, you know, on different advocacy days, trying to bring more awareness, because currently those who are DD waiver recipients and are living in like group home settings do not have access to certain things like mental health skill building, which is a service that can really help address a lot of the challenges that limits their independence. So just really trying to provide a bridge to this gap in services. A lot of the times the challenges the population experience are being written off as simply behavioral. And that's where I come in, because I'm called in to address behavioral challenges. But then once I, you know, start collecting and analyzing the data, realize that it's actually a symptom of a mental illness that they have a diagnosis for, which requires something different than a traditional behavioral plan with consequences and stuff. So those are different ways that I am really trying to advocate and bring awareness to the mental illness crisis in the community as a whole, but then especially for those with intellectual developmental disabilities.
So speaking about the evolution of the mental health systems in Virginia, and I will pause and say, I apologize for my audio. I'm trying to get as close to the mic as possible so my sound does not cut out. But can you guys tell us a bit about how you have seen the system change since you have been practicing?
So I'll jump in with that. Since I started, especially, you know, even going further back. So my brother was a late 80s child, and, you know, his middle school, high school years were in the 90s and early 2000s. And during that time, it was a much greater, you know, stigma surrounded around mental illness, especially for the Black community. I'm noticing that is starting to change. It's a lot more common to hear about mental health problems, mental health challenges, mental illness. We're starting to hear about it more in a more positive way, in a more generalized way, which I think is helpful. We're starting to see more resources. I think it's also been helpful with social media. Like, we hear a lot of negative things about social media, but what I'm noticing is that a lot of the younger generations becoming a lot more open about their mental health struggles and challenges. And I think that is something that's been encouraging for, you know, the viewers and stuff. So I think it's this wave of discussing it more and realizing it's a natural thing, something that we have to be mindful of and take care of. So people are feeling more comfortable with reaching out for help and then just kind of supporting each other. So I think that's the biggest thing that I've noticed over the years. Martin, I don't know if you've seen the same thing or something more or different, but that's something I've noticed.
Thank you, Dr. Z. I think you did an excellent job of covering a number of things. I particularly agree with you that I feel like young people are less susceptible to pre-existing stigmas that existed. I feel like the news media, well, on the one hand, I feel like they're being more open to people's lived experience, particularly famous people, such as members of Congress, athletes, actors, and actresses. But at the same time, I still think that they focus a lot on violent aspects of mental health, which does not do a lot for stigma, particularly when people who have mental health concerns are far more likely to be the victim of crime than to be the perpetrator of a crime. I feel like while it should not be considered the ceiling by any state of imagination, I feel like governments on both the state and federal level are providing, as you said, Dr. Z, more resources for mental health. I feel like localities are coming up with more innovative solutions. I feel like 988 has been has gone a long way to address awareness of mental health and the associated campaigns with that. And I also feel like over the past several years, we've moved from more of a medical model to more of a recovery oriented system of care that, it went from focusing mostly on psychiatry and medication to taking a whole person approach to mental health recovery that starts with prevention and ends long after a crisis and throughout the process.
Definitely have noticed that too. And I do have to agree. That is something that I do notice and feel that we may need to, address more, is that there is a lot of attention to, tragic events and violent events being tied to mental illness. And in a way, it shows that we need more resources, or we need to continue having these discussions to try to prevent these incidents from happening. But the discussion kind of stops at, this person had a mental illness and then engaged in this violent act. So yeah, it's getting more of that attention, but some of it is probably still feeding into stereotypes and stigmas more than we would like.
How do you think that the COVID-19 pandemic impacted mental health at a societal level?
So I'll go ahead. I feel like COVID-19 had a profound impact on mental health at a societal level. Um, I think a lot of research indicates that isolation is not a positive thing for mental health, and it can leave a lot of people feeling alienated from their communities and from themselves and from the resources they need to live a life full of mental wellness. And COVID-19 showed us that life on our own can be challenging, since, again, as I stated before, being well often involves other people and your community. And so I think that had a negative impact on mental health at writ large, but I think that this negative impact also brought a lot of attention to the fact that we all have challenges at times that we can use help with. And I think that it also led to the creation and distribution of a lot of mental health resources and a lot of mental health awareness that might not otherwise been called attention to. And I also think that it led to a lot of innovation with respect to telehealth and things such as that. So what do you think, Dr. Z?
Yeah, I like just thinking back to that time period, it was definitely it was different. It was stressful. And I think depending on, you know, like what types of hats you wear, it brought different types of stress. So like if you were a parent, not only were you stressed out because it was a totally new situation and it was so many different unknowns with things changing each day. And I think in the beginning, you know, the news focused so much on how many people that we were losing, and it just kind of had like this doomsday vibe to it that was really, and then you're like isolated, and so it was really scary. But then, you know, if you're a parent, you're also like trying to be strong for your children, but then also be creative and, you know, be like kind of a counselor because they're missing out on special events and their usual activities. So it put a lot on us, you know, mentally and emotionally, and it definitely has, I feel like, lifelong effects to that. But like you said, I think some of the positives were making therapy sessions more, you know, accessible with the telehealth piece that came out. And a lot of things, you know, became more virtual, you know, like I know a lot of yoga sessions and people figured out how to do group meetings and chats and stuff with friends and stuff virtually. So while it was a time that was very stressful and hard on us, I think it led to us being a little bit more creative and finding ways to connect with each other personally and professionally. And I think it kind of made us stop and check in with ourselves more. And I think maybe that was the most stressful piece, because we're so used to living the lifestyle where you kind of go, 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 and you don't really have that time to really stop and check in on yourself. So I think that might have been one of the factors that really made the pandemic a challenge. And it really made people realize how much they use like activities and busyness and being around others to kind of cope with these feelings and you know, characteristics that they weren't paying attention to. So it was a very unique time that brought out some hardships, but then also some positives in a really weird roundabout way. So yeah, it's something that we'll definitely remember.
Speaking of those unique challenges and the increase in resource that kind of came out of them, what do you guys feel is the biggest current unmet need for Virginians experiencing mental illness?
I think we need more resources. We need more practitioners. You know, I think everybody has a lengthy wait list. We still have the challenge with coverage for services, especially if the individual is a Medicaid recipient. There's a lot of different changes going on with that, where more and more providers are not credentialed with these different programs, so it makes it harder for them to access it without experiencing a lengthy wait time. And then we still have, again, like the populations that are not keeping up with the wave. So while we may see advancements overall, we still have these other populations like youth or you know, the dual diagnosis as far as substance abuse and mental illness, intellectual developmental disabilities. And I saw someone put in the chat earlier and reminded me of the older population, and then those with other challenges like deaf, blind, hard of hearing, being able to find the right, you know, resources and support. So I think that continues to be a challenge. And then I still think we in Virginia, there's a lot of people who still don't understand mental illness and still look at it as this this call for attention, or a sign of being weak, or some other negative stereotype. So I guess those would be my two things: the need for more people to understand the importance of mental health and the impact of mental illness, and then a need for more universal or accessible resources to address the whole population, but especially those that are still not recognized when thinking about specializing and development of resources.
Would you please repeat the question, Virginia?
I think the gist of the question was essentially just what are the greatest unmet needs regarding mental health that Virginians would still face?
Okay, the greatest needs regarding facing mental health, is that right?
Yeah, the greatest unmet needs. What?
Unmet needs. Okay, first of all, as has been the case, Dr. Z had a lot of great points. I do agree that workforce is a huge unmet need, particularly the peer recovery services, peer recovery specialist workforce. To plug part of what Virginia will be, or Vocal Virginia will be advocating for this General Assembly. Barrier crimes is a huge obstacle to peer employment. There are a number of people who would be otherwise qualified, but for having made a mistake many years ago, we think that helping eliminate these barrier crimes and putting these people to work will help address part of the workforce shortage and give people some of the resources they need to move forward in their recovery. Access is a critical issue. There are a lot of people on Medicaid who might have trouble identifying a provider. There's also a lot of people whose insurance simply is insufficient or doesn't provide the coverage they need to get the services they need. And I think that we need to work to identify the gaps that are there in coverage to ensure that people can have access to the mental health services that they need. I think that there's a lot of social determinants of health that people need access to. I think this would just fall into an overall category of needing more resources, particularly in rural Virginia. These are things like transportation, housing, employment, the kinds of things that are necessary for someone to live a full recovery, because they're the things that provide stabilization and the kind of continuity that you need to be successful when you're facing a mental health challenge. And then also, I think that we just need to build awareness and make sure that people understand that it's okay to live with a mental health challenge, that it's okay to seek help, that there are resources available, and that there are peers who want to help, and that it's okay to be a peer yourself. As I noted, Vocal is comprised of over 2,000 peers. Our staff and our board member are peers. We take a great pride in making sure that peers stand up for themselves, self-advocate, identifying ways to express themselves in constructive and advocate in constructive ways that advocate for the positions that are important to them. So I think these are all a number of ways, a number of things that could be done to help fill the gaps that exist in mental health.
So you both have already touched it on the stigma around mental illness. It's somewhat better with more visibility and with better resources available. But can you talk a little more about factors driving that destigmatization and what we as advocates, as listeners, as people working and family members, what we can do to further that stigmatization.
So I think what I heard is that you said that we both have addressed that the stigma is changing, but what do we think is needed to further destigmatize mental illness? Is that like the gist of the question?
Yeah.
Okay.
And what can we as listeners do to be good advocates and to be good stewards?
Yeah. So I think the main thing is, just being open and having more of those conversations. No matter, whether you are a self-advocate or a family member of someone, it's just really showing that it's something that we all have, right? No matter what your title is, what your gender, your sexual identity, your social economic status, no matter what, this is something that affects all of us. And Martin, you did bring up a good point when you mentioned things that Virginians still need to address the mental illness. I think a lot of times people think of mental illness as just like, oh, you're having a hard time and you can't handle it. But you bring up a good point that people overlook often. It's also like your quality of life. So in order to truly address the issue, it's more than, just having more psychologists, psychiatrists, therapists, like that's great. But making sure that we do have access to affordable, housing and meaningful employment and things like that is very important, because that affects our quality of life and then our mental illness. So your answer reminded me that mental illness is not just this category of health or psychology. It's something that's in all parts of our life. So we need to make sure that we're having these conversations, not just in settings focused on, advocating for mental health or advocating for, disabilities or psychology. We need to bring these conversations into, all areas. So finding time to talk about how housing affects people's overall mental health on committees related to, housing funding, or conversations about jobs, or conversations about education, or even conversations about transportation. Everything plays a part in our mental illness. And if we start having these conversations in all these different areas, it helps to generalize it. And it helps people to see that this is something that we all have, we all experience. It touches every part of all of our lives all day long. So I think if we start doing that, that will help to destigmatize it. It doesn't seem like it's something in this little box over in the medical field. It's seen that it's, everywhere. So I think that's helpful. I love how we're starting to see more athletes and professionals, like you mentioned, Martin, that are sharing their personal experiences. I myself am diagnosed with ADHD, anxiety, and depression, and I'm very open about my challenges. I share that with my clients that I work with, as well as when I do presentations and stuff. And just really share like the realness of it. It's not just I'm having a bad day and I want that pity. It's, it affects you deeply. And again, it leaks into all areas of your life. So I think by showing that it's a real thing, that can really help to destigmatize mental illness, and then hopefully get everybody on board with making some positive changes. I don't know if that is something you were thinking, or you think of more stuff, Martin, when you think of that question with destigmatizing.
So when I think about destigmatizing, I think about having conversations and listening intently, because I think that to destigmatize, you have to give people an opportunity to know and understand your perspective, the challenges you face, how you overcome those challenges, the way you work to build your recovery in a meaningful way. And one of the things that we've done is on our advocacy day, we take 40 people with lived experience to meet with their legislators, so that legislators and decision makers have an opportunity to hear from people who are peers, who have lived experience of mental health challenges on issues that are important to them. And we think that this goes a long way to remove the stigma, because it's no longer just an abstract idea. It's not just people with mental health, but they're actually constituents, people who vote for them, coming to their office to see them, to make their positions clear on important issues. I think that to destigmatize, or to work toward the destigmatization of mental health, you have to be an effective advocate. You have to build effective coalitions, and you can build effective media campaigns to let people know what it means to live with a mental health challenge, but more importantly, what resources are available for people who are looking for an opportunity at recovery.
So with all that in mind, how can somebody start a dialogue about mental health and wellness with the people in their life?
Yeah.
I think it's, oh, go ahead, Dr. Z.
Nope, I'm gonna let you start out this time. Go ahead.
That's okay. I was just going to say, I think that, a dialogue about mental health, it depends on where the parties are coming from. A lot of people have a lot of different levels of experience with mental health, and a lot of people have a lot of different levels of training and a lot of different levels of sensitivities. So it depends on whether that conversation is taking place with someone who's more of a professional or someone who's more of a friend and family member. Conversations with friends and family members should be, I think they should be honest and candid. I think that, you should be sensitive to the person's position. You should be a sensitive listener and try to absorb as much information as possible without giving feedback that would be misconstrued or construed in such a way as to diminish the person's concerns.
Yes, I have to say ditto to all of that. Another thing, it's a personal topic, and like Martin said, it definitely depends on your type of relationship with the person. Because it's so personal, it can be a hard conversation to get started. But I am known for using TV shows or movies, and then, social media. I follow a lot of social media accounts related to mental illness and all things related. And I'm not unknown to see, something on a social media page and then share it with somebody, and kind of use that as a way to open the doorway to have that conversation, or mentioning a TV show or a movie that I watched that had something in it related to mental health, mental wellness, and then, bring up, oh my gosh, I saw this, this movie, or did you see the latest episode of whatever show, and then to talk about what was happening, and then kind of use that to share some of the challenges that I have, and then, bring up maybe an observation or, a general question to kind of help the person feel comfortable with maybe sharing some information. And then, like Martin said, when the conversation starts, it's really important to just sit quietly and listen, not to judge. Sometimes you may be surprised about some of the things that you hear, but not to judge, to let them know that you're listening, that you care. It's really a good idea to thank them for, sharing that information, because again, it's personal information, and it's hard to talk about. So if they trust you enough to share that information, then it shows that, that you have a special connection with them. And then depending on what is divulged, follow up with some suggestions of maybe some resources that they can utilize to help them. So those are my most frequent ways of starting that dialogue, professionally and personally.
So in your view, what are you hoping to see take place over the next year to improve mental health in Virginia?
Do you want to tackle that one first, Martin?
Sure. So there's a number of things that we think would be important or helpful in improving mental health in Virginia over the next few years. Obviously, more resources, more robust investment in mental health across the board, more investment in our community service boards and our state workforce, more higher Medicaid reimbursement for a number of services, including peer recovery specialists. The barrier crimes is something else that we want to see addressed. We feel like if more people had access to jobs, it might address the workforce issue. High need supports, employment supports and housing supports. As I noted previously, this is a Medicaid benefit under the 1115 waiver that is supposed to expire in December of 2024. We're working to get that extended, and also funding for the demonstration program. And also the decriminalization of mental health. People in crisis shouldn't have to fear going to jail or worse yet, being killed because they were in mental health crisis. Obviously, the governor's plan and funding for Step Virginia are important. So I think that those are just a few things that we could do to improve mental health over the next few years.
Yeah, those are all definitely on my list. I know I hear stories often of people being in crisis and, going to emergency rooms and just, kind of sitting in the emergency room for days because there aren't, any beds for them to be admitted to receive that quality of care they need to help them get back to that baseline. So that ties back into, more resources for the crisis level. But, if we have more and better resources, available for every day, then we can decrease the amount of people who are in or go into crisis. And like Martin mentioned, a person in crisis is that, a person in crisis, not a monster. And I still feel that when people are in crisis, they're no longer looked at as a person who needs help. And it leads to a lot of violence towards them, even though we often see, in the media, the person in crisis being portrayed as the violent one, when a lot of times they are the victim. So I would like to see that changed. I would like to see, more of these discussions and resources being introduced to people at a younger age. You're never too young to learn about mental wellness and how to identify your different emotions and how things make you feel. And then we'll be better able to pair your reaction or coping skills with whatever emotion you're feeling. So I think we need to start at that point, so that the little people that we have out there are better able to understand what they're feeling and then cope with that. And then they'll grow to, adults that are able to utilize those skills as well. So yeah, those are the main things that I would love to see changed. I saw in the chat earlier, somebody was asking if we were aware of any resources for children with, like developmental disabilities and mental illness. And it's such a limited process, and they had put in there about how the families are relocating to get to places like Kennedy Krieger and CHOP in Philadelphia. And it just goes to show that there's a great need for more of these resources, and hopefully resources that address before it gets to that point where they need such intense services. And not just the resource for the individual, but like the training and supports for the family, both those that educate them on how to help the person stay at a baseline and then recognize signs of them going into crisis. And then also for them to understand how to take care of their mental health and emotional well-being while being a parent, caregiver, or support person. Even our paid supports in the communities, how do they take care of their own mental wellness while being a go-to for somebody who fluctuates with their mental health? So I would just love to see just more understanding, and that understanding lead to a huge increase in resources. And of course, we need the funding for that. So, figuring out ways to add more funding to provide these services. And again, making sure that the services are accessible for those with intellectual developmental disabilities, for those with different cultural backgrounds, different sexual identities, because all of these pieces to us, this intersectionality really affects how we respond and the types of resources we need. So we need resources that keep that in mind and keep these different like subgroups in mind to make sure they're appropriate, not just a one size fits all generalized resource.
Thank you both for that. We have a few audience questions that I'd like to get to while we have time. If anybody else is wanting to ask a question, you can put that in the chat. We're going to do these first come, first serve, okay? Our first audience question is from Karen Rhodes with VDDHH. Karen wrote that it can be incredibly difficult for deaf, hard of hearing, and deaf-blind communities to access mental health and well-being services because of communication differences in cultural understanding. How can we break that barrier down?
Yes, I totally agree. And I think that is something that I would love to talk more about, because I think it's a matter of, working with the providers and bringing awareness to that, and then introducing them to different resources. And it's not just at those who are currently credentialed and providing services, but getting in touch with the different schools that, provide the LCSW and LPC programs and the psychology psychiatrist programs, all of those different programs, getting in touch with them and working with them to figure out how to add not just content that explains the unique needs for these populations, but then also, teaches various ways of communication to make sure that as soon as they finish school, they're ready to go with, appropriate diverse communication methods. So I will put my email in the chat, and if interested, I would love to chat more to see how we can add that to the current training that I have that focuses on working with those with IDD, because it's definitely a great need. And I'm not sure, Martin, do you have any resources that you can share that focuses on the deaf-blind, deaf, hard of hearing community?
I don't. Vocal Virginia focuses primarily on mental health, but it's something that I would be happy to learn more about.
Awesome. So yeah, I think one way to make the change is to have these conversations and, working together. So hopefully, we can work together and bring some awareness and promote some change, so that that is a group that is able to access the supports they need as well.
In the chat, Debbie Vermillion asked whether you were aware of more facilities or programs in the works for young adults with simultaneous behavioral challenges, developmental disabilities, and mental health conditions.
That is definitely a challenge. I think the places in Virginia that I'm familiar with are focusing more on behavioral and like skill development, and the IDD side, not as much that mental health side. The places that seem to focus on like all three, or the whole person, would be in Florida, and then like Kennedy Krieger, I've heard a lot about that as well. So again, trying to communicate with these already established programs and bringing awareness to this pillar that they don't seem to highlight when providing their supports and resources and services, and trying to see if there's a way to work with them to make this change so they are better addressing the whole child and not just one or two pieces, to get a more a higher rate of improvement and quality of life.
Martin, do you have any thoughts on that, specifically the programs and facilities in the works for young adults with behavioral, developmental disability, mental health challenges, maybe from a legislative perspective?
So I am so sorry. I do not have any research on this particular topic. I wish I did. Not to try to give an excuse, but Vocal Virginia focuses on adult mental health. So that's our main area of expertise. I'm very sorry that I couldn't be more helpful, but I'd be happy to look into it for anyone who's interested.
We had another question in the chat for Martin from Karen Rhodes. And Karen, I hope you will bear with me because I would like to expand this question a little bit, because I think Martin already spoke to it some. She asked, are the peers in Virginia, the peer mental health specialists, trained in how to support a deaf, hard of hearing, or deafblind individual who needs a mental health advocate? I would expand that question to also include people with other forms of disabilities generally. Are they trained at all in intersectional disability identity?
It is my understanding that this is part of their training. I'm not a peer recovery specialist. We do work very closely with a number of peer recovery specialists, and it is my understanding that this type of training is part of their process and part of the peer recovery process in and of itself. Any type of lived experience lends itself to being a valuable peer recovery specialist.
Mm-hmm. And Dr. Z, did you have any thoughts on intersectional training for professionals in the field that you wanted to share?
So again, I feel like that's an area, I think, because was such a great need to provide supports for those with mental illness, that the trainings were developed to try to get everybody out there as quickly as possible to try to help. And some of the populations that have diverse communication or support needs was not included in the development of those trainings, not because they weren't viewed as important, but I think it was, well, let's get the most trained just to get out there and be able to address as quickly as possible. And now there's a need to add, additional training and stuff to support those with diverse needs. So I'm not currently familiar with any groups that, are already trained. I think they all receive some training to learn about different populations, but maybe not as thorough as to how to provide specific supports related to their actual needs. So something that we definitely recognize is needed and are trying to work on and get going.
Fabulous. Well, that brings us almost exactly to 12:30. Thank you. Thank you to Dr. Z and Martin Mash for your participation today. Thank you to all of you who participated in this session. We appreciate you. Next, I believe there's a scheduled lunch break. Is that correct, Hera?
That is correct.
All right, so we will see you all on your next sessions, and I hope you have a wonderful day.
All right. Thank you, everyone.
Thank you. Have a
Thank
great
you.
day.